Hey everyone, we have a new video today about allergies, and this one is allergy terminology. And you might remember from a previous video what the word terminology means. It means any words that are associated with a particular topic. For example, football terminology would be saying things like goal, player, referee, football pitch, ball, things like that. So we're going to learn about words that are related to allergies. And we have a few other things that we want to cover today as well. Some symptoms of allergies. These are some symptoms that are different from normal illnesses normally. However, many symptoms of allergies may be similar, like coughing or sneezing could be a symptom of an allergy too. And then we're going to look at the differences between allergies and intolerances. We did briefly mention that in a previous video as well. So let's look at some of these symptoms. One of the most common symptoms is a rash. So this can happen with some illnesses, but it nearly always happens with an allergy. And this is it here. Just like the red skin, it will be bumpy and cuts. And when you have a rash, this is what you want to do here. You want to scratch it. It feels very good. So this here is called itchiness. It is another symptom of an allergy. So itchiness is the feeling that you get with a rash. So when you have a rash, it feels very itchy. You get itchiness with it. And next we have shortness of breath, so difficulty breathing, very common in allergies. And then the last one, we did mention it briefly, but it's very important for this one as well, swelling. And in this case, it is the guy's lip. You can see his lower lip is much bigger than his upper lip. And it's very common to see pictures of people who have a bad allergic reaction and their eyes and their mouth and even their whole face have swelled, and they look almost like a ball. So this is a very important term here, anaphylactic shock. So that is anaphylactic. It's a big word, and this is a very serious reaction, so life-threatening allergic reaction. And there are two really obvious signs, however, they will also get different signs as well. So the first one is shortness of breath, and the second one is swelling. So they may also get rash and coughing and other things like that as well, but these are some of the most obvious ones. If a person has an anaphylactic shock, their whole face could be swollen, and all this swelling makes it very hard to breathe. So they get shortness of breath and they can die because they cannot breathe, or their heart can fail as well. And to treat this, we have something called an Epipen, and this is the last word I want to teach you today. And this is just something that is used to treat the anaphylactic shock. And people with very bad or severe allergies need to carry these with them in case something happens. So in a previous video, I did mention that there is a difference between allergy and an intolerance. So I have an example: peanut allergy and lactose intolerance. Lactose intolerance is when you can't drink milk or eat ice cream, eat cheese, things like that. And then we have two other examples here: crustacean, like shellfish, and gluten intolerance is when you can't eat bread or pasta, things like that. So I want you to pause a bit of the video for a minute and just think, what are the differences between these? So if someone with a peanut allergy eats a peanut, what happens to them compared to someone who drinks some milk when they have a lactose intolerance? And actually the difference can be very big. So I'll talk about that now. So even though they have some similar symptoms, there are some big differences. And for example, allergies are normally quite serious. They can be life-threatening, so a person could actually die if they eat a peanut when they're allergic. And normally this is very fast acting, so if they eat something that contains peanuts, almost immediately they may start coughing and their face might start to swell. Whereas with intolerances, it's not life-threatening normally, almost never, and it is mostly digestive problems, so they'll get some stomach pains or diarrhea, something like that. They can also get rashes too. It is slower acting, so sometimes it can even take hours after they've eaten something they're intolerant to. And like I said, not life-threatening. Another big difference is for an allergy, some people only need to eat the tiniest amount. For example, peanut allergies. If someone is sitting beside them eating peanuts, that might be enough for them to have an allergic reaction. But with an intolerance, somebody could drink a small amount of milk and actually be fine. So that is today's video, everyone. Thank you very much for watching, and I'll see you in the next one. Goodbye.